Toxins are actually proteins, just like the proteins in our body, which tell all of our cells where to go, what to do, and when. But the toxins in Venom are mutated and tell key cells to do all the wrong things. When it comes to getting toxins into a victim, nothing can match the weapons of the Vipers, which have the most sophisticated delivery system of any snake. When it's time to strike, the mouth opens as much as 180 degrees. The fangs snap forward and sink deep into the flesh. Powerful muscles squeeze the venom from reservoirs behind the eyes into the fangs, which act like long hypodermic needles. The toxins immediately spread throughout the body. They target mainly blood cells and nerves. If it's a viper bite, the venom usually attacks blood, destroying the cells or their ability to clot. If it's a crate or a cobra, much of the venom will home in on the nervous system, ultimately causing paralysis or convulsions. These neurotoxins work by interfering with the communication between nerve cells or between nerves and muscles. They usually cause the signals to stop, freezing the muscles. When toxins reach the diaphragm, the muscle that powers the lungs, the victim will eventually suffocate. The only hope for survival is to reach a hospital where machines can breathe for you until the venom passes out of your body. It may take weeks to clear entirely. The wards of Hanoi's Bach Mai Hospital are lined with snake victims, many paralyzed by the bites of crates and cobras. Antivenom could cure these victims. Antivenom is created basically the same way vaccines are. Tiny amounts of venom are injected into an animal, which then produces antibodies that bind to the toxins and neutralize them. These can be extracted, purified, and injected into the patient. But antivenom is expensive, and even though it's available, it's far beyond the means of most of these patients, more than a year's income. And so the paralyzed victims, fully conscious but barely able to open their eyes, simply wait it out. The drooping eyes, so characteristic of neurotoxic venom, are familiar to Dr. Sean Bush, an ER physician at Loma Linda Medical Center in Southern California.
Shark bite is nothing compared to snake bite. That's just a trauma. Snake bite, that's like chemical warfare. It's really complex to deal with.
But unlike victims in Vietnam, Sean's patients can immediately be treated with potent antivenom. When 10-year-old Jennifer Hollis came into his ER, she was already in the throes of a neurotoxic crisis. She couldn't keep her eyes open and could barely breathe.
Can you take a deep breath?
She had been bitten by a Mojave rattlesnake, renowned for its impact on the human nervous system.
She was on death's doorstep. She almost died. She was hypoventilating. She wasn't breathing enough. The venom has made her paralyzed. She can barely even look up.
Sean quickly administered the antivenom, which began neutralizing the venom immediately.
And we were just about to put her on life support when we gave her the antivenom. Once it kicked in, it was like a miracle drug. It completely turned her around, and she could open her eyes, she could breathe.
How do you feel, Jennifer?
And she was happy, normal 10-year-old. Looking a lot better now.
Smile, Dan, you're on camera.
Can you smile? You look a lot better.
Sure do.
But neurotoxins can have a different effect. A bizarre spasming of muscles so severe, it looks as though something is squirming under the skin. This happens when, instead of shutting down, the neurotoxins set nerve cells on full fire. resulting in uncontrollable muscle contractions.
This is myokainia. That's the muscles firing underneath his skin in an uncoordinated fashion. It's just twitching uncontrollably. You know, I mean, this guy's an extremist. He's sick unto death, basically.
Some rattlers pack a very different punch, with venom that sometimes skips the nerves and goes to work on the blood. A strike from a northern Pacific rattler came very close to killing 22-year-old Jessica Fusaro 6 months ago. The toxins in the rattler's venom shredded her blood cells, as well as the platelets that allow the blood to clot. Jessica bled internally so intensely that she bruised from toe to ribs and swelled up like a balloon.
I mean, and this is, you can feel that bruise, her back, all the way across the other side. I mean, it was the biggest bruise I've ever seen. So if she doesn't have enough blood, she can't oxygenate her tissues, she would eventually have bled out and would have died.
Only massive amounts of antivenom saved Jessica's life. Not all snakes are highly venomous. The majority of the world's 2,800 species manage to be effective predators without it. From the tiny blind snake to the massive anaconda, which squeezes its prey to death.